What's up, everybody? Welcome back to another episode of
What's Your Problem? Boom.
Today, we have a professional with us in the studio.
Yeah.
And this professional, he's not any type of professional.
Yeah.
He's pro in some people will call it dirty things lah, right?
Is it, man?
I don't know. Some people like to suck it.
Ooh.
Some people don't like.
Some like to play with it.
Some people like play with it. Most men like to play with it.
You? Okay.
Most wives also like to play with it.
Okay.
And he is a doctor of this thing you like to play with lah.
Can I say it?
You can. Dicks! Okay, today we have a guest. His name is Dr Taufiq Rashid.
Yes.
Long story short, he is a dick doctor.
Yep.
He is a doctor for dicks.
Wait, that sounds a bit wrong lah.
Okay,
but scientifically or politically correct, he's a penis doctor. Is penis the scientific word?
No. I usually call myself men's health lah. Men's health doctor.
Okay, men's health doctor.
Yeah.
Men's health is a whole spectrum. Right?
Yes, that's right.
You specialize in men's private parts lah.
I mean, we all assume that men's private part is an important part of men's health, right? But it's
The most important.
encompassing lah. It's all encompassing, yes.
Okay, would you rather...
so fast ah?
Because he say all encompassing, right?
Okay.
That I say the dick is the most important.
Okay.
Okay, so what would you rather? Like Tom got no hair or your dick cannot stand?
No hair.
See? Can we ask you that question?
Sure.
Would you rather be bald or you have erectile dysfunction?
I rather be bald.
See?
You?
See? Most important. Of course I rather
But
be
you
bald.
facing both what?
Okay, no. So interestingly, I mean, if you guys don't know him, on TikTok he's called DICKDOC.
DICKDOCSG. DICKDOCSG.
DICKDOCSG. If you want to find out more on him, you can go and search later lah. But we invited him to talk more about this men's health.
But before we do that, who do you think is the target audience today?
Both bro.
Right.
I think men and women both. I
right.
think a lot of problems, even though the men know it, they don't want to go and get it checked.
Yes.
They need to be encouraged by someone. If let's say you guys have boyfriends or husbands who are going through this, I think you should talk to your husband about it, in a sense where don't make him shy about it. Don't make him embarrassed about it. It's normal. Like, go and check. Yeah.
Okay. So disclaimer first, I will try to be as proper as possible.
Yes.
But this is the first time I'm talking to a doctor about dicks. Right? So I will ask questions that any random Joe would ask.
Okay.
Please go ahead, yes.
Go ahead. So
Yes.
you are fine with it.
Yeah, got a green light.
We don't want to be so boring. Right?
Yeah,
We talk
yeah.
about dicks, bro. Not every day we talk about dicks. Okay, go ahead. Please, carry on.
Okay. I think we would like to start. Okay. So, I mean, I mentioned erectile dysfunction, right? So, okay, wait. Now we talk about you first. Okay?
Yes, how it
How
started.
did you even become a dick doctor?
Okay, so basically I'm a GP by profession, general practitioner.
Okay.
So when I was doing my GP work, normal lah, the cough and cold and all that. So I noticed that men usually find it difficult to share their problems. I mean, whether it's a health issue, normal health issue, or especially men's health issues. And I find that I help them feel more comfortable, more at ease to share their problems. And I also find that most doctors usually don't want to spend time on this issue also. And that's why patients are shy to talk to their doctors about it, because then they'll feel uncomfortable or they feel like the doctors don't really bother too much. Usually they just give them medicine and then they go off. So I find that by providing a safe space, they feel comfortable talking to me and they can just tell me all their problems and they don't feel judged.
Okay.
And at the same time, they have a solution. Yeah.
Okay. So, from being a GP, right, to be a profession in penises, is there an extra course that you have to take, or?
Yeah, so basically, I'm not the specialist urologist. So urologist is more like extra studies, extra specialization. But I'm still a GP, but focus on men's health. So I do take up specific courses related to men's health topics.
Okay. And now you're on TikTok talking about dicks lah.
Yes.
Is it on purpose that it's called dick doc?
Yes, so it's on purpose because I think at the end of the day is when I use the word dick doc, people know what I'm talking about. Basically about men's health issues.
Yeah.
I mean, it would be boring if he calls himself the penis
Doctor.
specialist. Right?
Because
Dick
then
doc.
a girl can use that one.
Why?
Right. Like, if
Yeah,
I'm
it
an
can mean a lot of
OnlyFans girl,
things.
if I'm an OnlyFans girl, I start a TikTok. I'm a dick specialist, dick surgeon.
Men also can what?
If they like dicks lah, if they swing that way lah.
Let's
But you
not
know,
go
but,
there.
yeah, okay.
Let's not go there. Okay,
Okay, so
how
now,
many years?
How many years have you been doing this?
So about 7-8 years,
That's
focusing
long.
on men's health.
Okay, let me ask you. This is a random joke question. How you talk about your you specialize in men's health, right? Mental and physical. Am I? Mental also.
Mental, not so much.
Not so
More of
much,
the physical, yes.
So do you feel like, okay, after 8 years of looking at dicks, does it take a toll on you? No.
Actually, no, because I find that men's problems are quite straightforward.
Okay.
So when men come,
If it can become straight lah.
when men come to see me, they will tell me exactly what the problem is, and usually it's quite I can easily solve it lah. Like it's very straightforward. Versus if I see women on the other hand, usually it's a bit more complicated in terms of their health issues. So it's not as draining as seeing women or children patients.
Okay.
Yeah.
Wait. Why would you see? Oh, this is doing a GP.
yes.
Oh,
Yeah.
okay. So, apart from, I think everybody know like the men's issues. Issues that men will usually have lah. And I think the number one is erectile dysfunction, right? And I think what we don't know is what are like everyday things that lead to erectile dysfunction. Yeah, because I feel like erectile dysfunction, right? I mean, there's a lot of causes, right?
Yes.
And sometimes when men get erectile dysfunction, they're like, but I'm healthy, but I'm doing this, I'm doing that. How come I have erectile dysfunction?
Yep.
Yeah.
So erectile dysfunction is very interesting because usually if your man see a normal or usual GP, the GP will just give them Viagra and then they go off. You know, and then they will solve the problem. In a way, like it will solve the problem because Viagra, right, it works. But actually, like you said, there's a lot of causes. So normally when I talk to them, I try to find out other symptoms or other concerns lah. For example, maybe do they have a lower sex drive? Did their sex drive get affected? Do they have lower energy? Do they have does their mood get affected? For example, maybe they are usually feeling low mood, like easily sad or easily angry. So all these things could be signs of low testosterone. So
what are the causes for low testosterone?
So there's also another topic lah.
Yes.
But basically, most common is aging. So men, especially above 40, tend to have testosterone lower as we age.
Yeah.
Yeah. So of course, other factors will be like lifestyle factors, lack of exercise, obesity, poor sleep, stress, certain medication also can affect. But most commonly is aging. So men above 40 especially, they tend to have this issue. So that could be one of the major factors of erectile dysfunction. Another main group is chronic diseases.
Okay.
So I've picked up quite a few guys who never seen doctors before until they got erectile dysfunction and then found to have diabetes.
Diabetes?
Yes.
Is
so
it because
it's a
of
common
kunafa?
One of the causes. Yeah.
causes, yes, maybe.
Wait, so your clients are more of the elder generation lah? Or
Also
it's good lah?
not true because there are younger and younger men with these issues as well.
I see.
Wait. How does diabetes? I mean, this affects a lot of Malay people, right? Because a lot of Malay people are diabetic. So how does diabetes affect erectile, cause erectile dysfunction?
Because when they don't go for health screening, so they don't know they have diabetes. So they just live with it for a long time. Their body goes through, they have high sugar level in the bloodstream for a long periods of time. Then they get complications. Too much sugar level in the blood will affect your blood circulation.
Okay.
So they will affect blood circulation in the smaller organs first. So things like your eyesight, your kidneys, your hands, your feet, and your penis.
So and your penis needs blood.
Yeah.
Right, that's how
That's how it gets engorged and get an erection.
Okay, you see, now I have a new reason to tell people to stop being fat.
Yes. 100%. No,
Right, for me, back then I was all about, the libido, like, you look like masculine. But now I can tell them, if you want your dick to stand, stop eating sugar. Too much sugar, sorry.
Yeah, I mean, obesity is also one of the main causes.
Another factor, yes, another cause, correct, on its own.
I give a disclaimer first. For the women who are listening to this, I think I suggest you guys should stay, especially those who are married, to understand your husbands. So if you want your husband to give you one time good one, cut down the sugar. for
Yes.
him in the dishes.
Yes.
Correct or not?
Yeah.
You know you cook the asam pedas, the lemak cili padi. You can cut down the sugar. Every time you hold the spoon of sugar, you think tonight you get or not.
Direct.
You know, what's this? Oh my god, I totally lost my train of thought. No, okay. So why for couples, right? Actually, working out together is will make you horny also.
Yeah.
If you guys are lazy to work out, I'm telling you, working out together will increase your libido, and you guys will want to have sex.
But doing it is also a workout, what?
No lah, but I mean like I mean
Before
yes.
doing it,
yeah,
because
before doing it,
so
yeah.
that you can do it better.
Yes.
Ooh.
Yeah, so working out together increases your I mean working out in general increases your libido.
Okay.
That's why a lot of people are cheating in the fitness industry, you know? Have you
Really?
heard? Yeah, a lot of people are cheating.
You are in the fitness industry, right?
Not anymore.
Okay.
Not anymore.
Okay, I want to understand. So, you're a specialist for men, right?
Yeah.
How do I structure this question? For men, is based on this. How about for women? Do you have basic knowledge for women?
Based on what?
Like their sexual, their hormones, their drive, their sex drive.
Yeah, so their hormones are a little bit different.
Yeah.
But women also have testosterone.
Okay.
So, and testosterone is also partly responsible for their sex drive as well. So as they age, they also have lower levels of testosterone, and then that may affect their sex drive as well.
I see. I thought it's all about emotional.
But women, when you talk about sex, yes, you're right. Emotion is a very important part of their sexual experience and satisfaction. Yeah.
That's why all our makcik
What?
and
Your makcik lah.
all our makcik all very unhappy, bro. Because our makcik all very unhappy. You realize not? Like when we go raya, they say this kind of stupid things, right? Because the inside they very unhappy because they tak dapat. Because they fat. Because they fat. The husband also fat.
Hey,
Both tak
can you
dapat.
stop attacking makcik not?
Okay.
This guy go and attack the makcik carry
They
hernia.
attack us first. They attack us first, what?
Okay, now moving on. I heard you also do circumcision.
Yes.
Hey, wait. I got one more question
Okay,
about
go.
testosterone.
Ah,
So
okay.
I know you can inject TRT, right?
Yes.
So this is to raise your testosterone
What's
levels.
TRT again?
Testosterone replacement therapy.
Yes.
Mm.
So a lot of bodybuilders, they inject TRT and steroids, right? So they raise their testosterone, they can go bigger.
Yes.
So is there any natural ways to raise testosterone apart from working out or anything like that?
Okay. So generally, boosting testosterone similar to erectile dysfunction lifestyle improvement. So of course, exercising, especially weightlifting, building muscle, boost your testosterone. So weightlifting itself boosts testosterone. Better sleep. Because that's one that most people miss out, because nowadays the hustle culture, everybody's just working harder, so they forget to sleep properly. So, and it's also getting harder to have a good night's sleep. So proper sleep, good quality sleep, and stress is another big factor. So I've seen younger guys in their late 30s, you know, high paying jobs, high stress jobs, testosterone also low because they're just so stressed.
Okay.
Yeah.
Got anything that we can eat?
Okay, to eat, there are supplements, a lot of different ingredients that have shown some possible effects.
Okay. Come.
Because usually they don't do, when you talk about medical scientific studies, usually they don't do big studies lah on this supplement. Usually smaller groups, like a few 50 or a few hundreds.
Okay.
Okay, a few things that can help will be things like ginseng. Ginseng is known to improve testosterone. Tongkat ali also known to improve not just testosterone but also blood circulation, erection. There's also things like ashwagandha that helps. Recently, people talk about shilajit, but shilajit not enough studies yet.
Shilajit is so expensive, by the way.
Yeah.
Have you heard of it?
Shilajit?
I don't know how to explain it. Do you know how to explain shilajit?
No.
Okay.
Is it
but
a plant or what?
Yeah, something like that.
it's like
it comes in a very small package like that. Like that, right? And then you just take 1 milligram of it. It's like a black goo. You just put in your cup, and then it's like creatine. So how you
powder?
consume it? No. It's jelly
It's like pocha, yeah.
Not even, bro. It's like
What?
jam. It's like jam. It's sticky and sticky.
Okay,
and
okay.
Residue,
Yeah. So basically, you consume it like how you consume creatine.
Okay.
You put it in your drink and then you drink. Yeah, and then it's supposed to give you a better lifestyle, lah. So more energy, better mood, and everything.
Sure or not? You see, studies not enough, no?
So,
Yeah,
so
that
a
one,
lot of my friends take shilajit and they say it's a
So it's based on individual experiences. But of course, certain vitamins like they are more known is vitamin D, zinc. And these are more well known because they helps with the testosterone. What do you call that? Improving the testosterone levels in the body. Vitamin D and zinc.
I see.
But generally, supplements you cannot rely on supplements alone if you don't do all the other things.
Yeah.
So that's why I also talk about testosterone optimization.
Okay.
Because there are men who maybe they try all this already. They exercise, they sleep well, or sometimes sometimes they just cannot handle everything at one go, right? Sometimes they need a bit of help. So some men with borderline testosterone or maybe a bit lower testosterone, they need a little bit of testosterone replacement, or we call it optimization. That helps with their overall improvement, like better sex drive, better energy. They can perform better in the gym, and overall better mood.
Does
They
it
can
depend
change the mood.
on genetics as well?
Not so much.
Not
Not
really.
so much. Yeah.
So
It's
if
a lot
my
of
bird
lifestyle.
cannot stand, I blame my father. Cannot.
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 You blame your
Cannot.
wife.
That's true.
But it says natural. Okay, wait. Just now you mentioned steroids. Is it true that bodybuilders have go through this problem?
Yes.
Okay.
I say yes. Yeah.
So because that happens because they take too high doses, and sometimes they stack with a lot of different products that affect your sex drive and your erection also.
yeah.
Yeah.
And if I'm not wrong, for as long, I read this online. For as long as you are adding in testosterone in your body, the fake way, your main testosterone level will go down already.
So it will suppress. So for my patients who take testosterone replacement, your production will be suppressed.
Yeah.
The natural production.
Yes.
Yeah.
And to increase it is the normal way, like exercise, eat well,
Mm.
sleep.
But once people start taking TRT, they just don't stop already. Yeah, they will just continue
So
taking.
the problem is because most bodybuilders, they take high doses. So they feel sort of like dependent on that high doses.
Oh, it's like pre-workout.
But then those that I help with optimization, they just take a enough dose for them to feel the benefit without too much of the side effects.
Okay, so
Yeah.
it doesn't really affect the natural.
Correct. So you still can
Production.
produce, but it's just like a little bit enough to supplement whatever that you're producing.
Yeah.
I see.
I would recommend ashwagandha though. Because I take ashwagandha. And morning wood is real, bro.
Really? Ah?
Real. Yeah.
Then your left hand come in.
No lah, I wake up to pee then I go back sleep.
Okay.
Apa kau?
Okay, now can I ask you about the?
Can.
Okay, you already do it or not?
Do what? Sunat.
Sunat.
I can't remember when I sunat.
I thought you can't remember you do or not. Okay, so doctor also does circumcision, am I right?
Yes.
Chinese people better listen this one.
Okay, what's the? Okay, so
Yes.
I think our manager asked you to bring a prop. Can
Okay.
we see or not? Okay, those who are watching.
This is okay. Those who are watching, this is the state of the art circumcision.
So back then
device.
our time was traditional.
So
Wow,
I
giving me tickles already.
Tingles. I actually use two different methods for circumcision.
Okay, those who are listening on Spotify, turn on the video now.
Yeah.
Okay.
So basically, I have what we call the stapler method. It's a stapler
Ow!
device. And the other one is called a Shang-Ring device.
Oh, this
A
one
what?
last.
Shang-Ring.
SHANG.
Yes.
Okay.
Is that like the Marvel movie?
Yeah, that's
Yeah. And then when they came out with the movie, I was like, oh, this is like Shang-Chi.
Yeah. Okay.
Yeah. So
Stapler.
correct. So
That
the
doesn't
whole
sound
idea
good,
is that traditionally to do circumcision you have to cut and stitch.
Yes.
Okay. And then for that to happen, you need to have a big injection for the anesthesia. So the advantage is with these devices, I just need to use a numbing cream. Numbing cream, so there's no big injection.
Okay.
First of all, and then second, the procedure is so fast. So maybe 5-10 minutes. So it's so fast that at least you don't have to so-called suffer so long lying there waiting for the whole thing to finish.
Yeah.
So it's like within 5-10 minutes, done. Then they can go home already. And recovery is faster. Like they can shower, they can pee, like not as painful as last time.
Not fair, sir. Why they never come out with this back then? You know
No,
how many
wait.
months I suffer not?
I thought now got laser.
Okay, so laser also is one of the methods that also allow you to recover fast. But the difference is sometimes laser, you still need a big injection, one, and then you also may need some stitches.
And this one don't need stitches?
No stitches.
Stapler? How is stapler
How
work?
does that work? Wait. I'm not asked. So last time our parents would tell us, right, the injection goes through the hole.
No, not
No.
through the hole, no.
Okay.
That one gonorrhea.
Oh, I know. No, my father tell me
Your
once.
father wall prak.
I don't think your father will have seen the procedure lah.
Okay, so it's just around.
Yeah, it's actually just above the penis in your suprapubic region.
Oh, like this, like the hole here, on top here.
No, the pubic region.
You have right there. You're not his
the
own dick
model
lah.
No, I thought
The model lah.
Yeah, the model lah. They call it the
So
model.
it's not on the penis.
okay, what besar lah saya.
Okay, for easier to see. Okay.
Okay.
So it's actually not on the penis itself. It's actually on the suprapubic region, the injection.
Okay.
On
So they
top
inject there.
and below.
Oh.
So it's around.
So that's how our time they do it lah.
Yeah. So
Okay.
they're still doing it now. For those who want to do the conventional method, they still have methods where they use the cut and stitch. So you anesthesia is around there.
Okay.
Oh.
So it's a big needle lah, because
Big
imagine
needle.
you have to poke in here. Yeah. So it's the most painful part. After that, no pain lah. Because
Like okay, when they poke in there, right? I mean, they poke anesthesia lah.
Yes.
To numb
The whole area.
the whole area, right?
Yes.
So 33 years ago, I mean, I'm 33. He's also 33, right?
Okay.
When there's no technology,
Mhm.
how does this bapak tok?
Oh, the kampung
Yeah, the
time ah.
kampung style. How they know like?
No anesthesia.
I don't know how they did it last time. I have no idea.
Bro, that one, that man, bro.
No, but if you think about it, right? If there's no technology last time, like how do you know where exactly to inject? You can't. The area is
Oh.
big, bro.
I mean, to inject, I'm sure they also taught them how to inject the anesthesia lah. I thought you were asking about before they had anesthesia.
Oh no! I'm talking
Okay.
like our time. Then like see the
You
thing
mean
like
the top mudim ah?
yes.
Oh, yeah. I think some of them they also learn how to do the anesthesia.
Okay.
Yeah.
Okay.
Okay.
So we
Now-
go Islamic can or not? Okay, why need to sunat?
Okay. So medically, there's a lot of benefits for circumcision. So you have reduced risk of infection. So I've seen a lot of patients who are not circumcised. They come to see me when they're adults, right? Because they got a very bad infection. So by doing the sunat, you already reduce that risk. Second, you also reduce risk of STD or STI. You also have reduced risk of HIV transmission. There's also other things like herpes, warts also reduce the risk. And I think generally hygiene
Yeah.
is better.
Yes.
So I also heard girls say.
Who?
Many girls say.
Okay.
Some girls say, I swear, I not from my mouth because I never seen it before, right? So some girls say when they have sex with people who are not circumcised, they pull down the skin, there are crust coming out. Because it's dried pee or whatever it is, right?
Yeah, so there is another problem with some men who don't know how to take proper hygiene, do proper hygiene.
Don't know how to wash properly.
Yeah.
Serious, bro.
Okay lah. I sunat already. What?
Okay.
Yeah.
Then
So
okay.
those are the benefits. So that's why I highly recommend, I would say all men to circumcise. But of course, there's always the fear, right?
Yeah.
Pain, or maybe they feel like, cannot have sex for a long time and things like that. And of course, I always reassure them, because thanks for these new devices, there's no injection. So you just apply numbing cream. And then the procedure is very fast. They can go back the same day. And the recovery also quite quick, about a few weeks. And most of them are very happy with the result. Aesthetically also looks good, because instead of stitch marks, they have one single line. So sometimes of course they feel better, that it looks nice, right? No point you cut, then doesn't look nice.
For me, the recovery was the most painful, and every time I
You can
pee.
remember?
Yes, bro. You cannot, man.
How old do you do yours?
I think I was primary 3 or 4.
Oh, I wasn't
9
that
or
old.
10 years old.
I wasn't that old.
You?
I was way younger. Maybe I did it like when I was baby.
Is it?
Yeah, most probably baby, because you don't remember.
Yeah, I don't remember at all.
I remember. And then I had to wear the
Kain.
After I pee, every time my father will put the fan in front of me and just like, I don't know lah.
So the
So
kain don't
painful.
stick on your blood.
I don't know.
Yeah, I mean,
Is
Because
it?
it's sensitive.
Yeah.
The head is very sensitive. So you feel very painful.
Oh.
It's like knives, right? You feel
Yeah,
like knives.
yeah.
Because it's very sensitive.
Every time I
crazy.
pee. Every time I pee. And then the last time was stitch and then ring. Is it the same now?
So no stitches. No stitches involved.
What is that? It's
So
like a
this
wedding
ring, yeah, so this is the shang ring lah. So because once you put the inner ring inside, then the foreskin around it, then this will clamp on the skin. Once clamp already, it's very tight. No need to stitch. Then I just remove the extra skin.
Uh-huh.
Then the whole thing will stay there. then drop out about 2-3 weeks.
Oh.
So this ring will stay there for
Yeah.
3 weeks.
Like this,
Yeah.
like this.
Then no need, then no need bandage, no need stitches. They can pee, they can shower. It's very easy to take care.
Oh. Back then was like I think it was the inside ring.
Yeah, then they had a stitch. They had to stitch.
Oh, they have to
Yeah.
stick the ring there to hold
So
it.
I mean, technically this one is to bring up the skin.
No, bring down lah.
Bring down
Cut
the
already,
skin.
No,
right?
it
The thing's
doesn't
cut.
bring up the skin.
Okay.
Basically, the inner ring will go inside. So it's on the inside. The ring.
So now
inner
your thumb is the dick lah, right?
Yes.
Okay.
So the ring is on the inside, and then the foreskin is covering this inner ring. This clamp will clamp on the skin itself.
Oh.
So then you just cut the top part.
I just cut the extra skin outside.
And you cut with what?
Scissors.
Oi!
And then the skin will slowly fall off, is it? Or
Yeah. So
on the
once,
spot?
No, not on the spot. So that's why once the skin heals, the wound heals, then the ring detach.
With the skin?
Yeah, with the skin inside lah. But the skin is the outside skin is no
Take
more
out
there.
already.
Yes, it's just
Oh.
the skin inside the
This
ring.
is to hold the...
Correct, seal the wound.
Okay, now I get it. Because last time, I stitch. My brother was ring. I can't remember, was it? Stitch also got ring, right?
Yeah, so
I
sometimes
think,
they have both the older versions of the ring.
Yeah, I don't know, old people say go and swim in the sea. Later will drop out. Is it true? Is it a myth or not?
No need to swim in the sea lah. They call it a seats bath. Basically, you just need to soak the whole thing in water. That's all. It's just that easier to go to the sea, right? Because you
Yeah.
have to soak.
Oh.
But then, I mean, it can be a bit painful lah if you go to the sea because the
Salt
sea water.
Yeah.
I see.
Okay, and then this one looks very dangerous.
Yeah, it's like a torture device.
Yeah.
Yeah, it looks scary because it's like such a big thing on your penis,
Yeah.
right?
This one like open wine, no, bro. Open wine bottle.
So you first, this part.
Hey! Why the thing come out so big? Ini don't want lah.
No,
No, it's not to put inside your dick lah.
no, we like you put on the head. This is to protect the head of the penis.
Okay.
And then the foreskin goes around it. Okay. And then you insert the whole thing inside the device. And then after you tighten, so when I squeeze the trigger, what it does is that it will cut and also apply the staples at the same time. So one shot, done.
It's like a hole puncher.
Yeah, hole puncher. Yeah, I get.
Yes.
Same.
But on your dick.
Can I see?
Yeah.
You try and smell. Got
Wait, so I yeah lah, Syam. Okay, so this one goes on the dick head.
Is this for props or used?
No, this one for pro.
For props. Okay.
Oh, so then the skin will be around here lah.
Yes.
That's crazy, bro.
I say I'm a random Joe. What? Okay, wait. So this one my bird. This.
Yeah, the mic blocking.
Sorry. Okay. So my bird. So this is covering my.
Yeah,
my-
so the
my
skin is
dick
covering
head, right?
already lah. So
Yeah. So you put the skin around it.
Oh, so the skin I bring up here.
Yes.
Like a sock.
Mm.
Bring up here. Put here.
Yes.
And-
Then you
Did you cut my finger?
No lah, your
no,
finger
there,
cover.
protected what?
Apa kau?
Oh, there's a blade inside.
Ah.
Oh, there.
Don't touch maybe sharp.
It's sharp ah.
See there. See.
But no more staples lah there.
Oh.
God.
But this is, I think it looks safer.
Who came up with this?
The Chinese also came up with this.
Huh?
The irony.
The contradiction.
Because they have a lot of foreskin to cut.
Oh yeah. Means they got more
Sorry,
customers.
Where's the top part?
Sorry.
Yeah, it's all here. Yeah.
Oh, it's all here
more
already,
already lah.
Oh, okay. Sorry, there was a screw I thought it was missing.
Okay.
Okay. Based, how many people? Okay, which one usually people choose?
Usually the ring lah, because less scary, just like that.
Oh yeah.
Then this one is bigger. But some people, because the advantage is the stapler recovers 1 week earlier. So this one is 2 weeks. This one is like maybe 3 weeks. So they want to recover earlier. They choose the stapler.
Oh, it's only the recovery that is the difference lah. The pain, no,
Yeah, not much difference.
not much difference.
Whereas this one, you have the plastic ring on the penis, right? Whereas this one, you only have staples with small silicone ring.
I see.
So it looks smaller lah, less than the plastic ring.
I think this will be
Okay.
good also for parents.
Yeah.
Parents who
100%.
wants to send their sons.
And how much is circumcision now?
Okay, so for the kids, it's around 1,003. Then
That's
for
okay.
adults, it's about 2,005.
Ah, why?
$1,000
Based
more.
on the size, is it?
and the noise they're gonna make also. They cover.
Why the difference in pricing?
Yeah lah. So because the adults require a different what do you call that, like expertise and experience
I see.
because of their, you know, when adults they have erections and all that compared to kids.
Oh yeah.
So you worry about more complications.
Okay, makes sense.
Oh, so you have to be soft
But
lah.
no, you do it yourself, right? For the patients.
Yeah. Yes.
Then got this.
I would say 99% no, because they're so worried they won't get turned on.
Oh yeah, who will be turned on?
Yeah lah,
Only
bro.
occasionally once or twice lah have.
Have ah?
Yes.
Then how you wait lah?
Wait lah, because the size is when you're flaccid.
How you? Oh, you must wait.
I must measure.
Oh yeah.
Yeah. They're different the sizes.
You know last time army checkup, they must stand
Hey,
one side.
you
then,
and Pobik also say the same thing.
then you cough.
I never kena no.
You never kena?
I never.
Maybe you already got down pass ah.
No. I don't.
You kena?
Yes.
Yeah.
Yeah, Pobik say the same thing. They ask you to cough to do what?
Yeah. So
Check for hernia.
okay. So what's that? Can we have a scientific explanation for that?
Because if you have hernia, your balls will not be able to go up.
Okay.
The balls will stay down. When you cough, the balls supposed to come back up towards the body.
And what's hernia?
Hernia is where like the contents of the abdomen protrude out through an opening along your abdomen wall.
Mm.
Some people the wall is weak, so they have an opening.
Okay.
So then it becomes like a sac.
oh.
And then when these things become loose, the contents of your abdomen goes into the sac. Sometimes go into your scrotum, and then when you cough, it doesn't come back up.
Okay.
Okay.
Now you know.
Now I know. Now I know. Last time when we don't know that time, everybody say, "Oh, check whether you gay." You got hear this one?
No. Then just cough.
Because some people say, "Yeah, open pants in front of a guy, must see whether you gay." Of course, this is secondary school time. They say
Yeah.
lah, you know,
Yeah,
or like
yeah.
you know, after secondary school, then you go check up. Then they say, "Yeah, check
Okay.
whether you gay, bro."
No lah, they want to.
Okay, so we go back to libido and men's sexual performance and whatnot. Is it true that masturbating a lot affects your affects your overall men's performance thing?
Okay, so it's all about moderation. Of course, if you masturbate a lot, of course it will affect your performance, because usually if you masturbate too much, there's a related problem like maybe porn addiction or addiction to masturbation. Then if you have that problem, then it's going to be difficult to have a healthy sex life with your partner.
I see.
So if it's too much, of course it will cause problems. If it's too little, maybe may also have problems if you don't what do you call that, have regular sex. So it's advised to have release. Some say that it's advised to have regular ejaculation to reduce the risk of prostate cancer. Some studies lah show that. Yeah.
Oh.
Because it's all stuck there lah.
Yeah.
You have to release it. Okay.
Correct.
Oh, okay.
And if it's all stuck there, it actually doesn't have to reproduce more.
Is also what?
So if you don't masturbate, then will your testicles still reproduce more sperm? Because you don't use it?
It will still produce. So the sperm will still die off,
Okay.
and then new sperm will produce.
Is there a limit?
Limit to what?
1 gallon.
Limit to what?
Will it okay, let's say a guy who's a virgin and super Islamic would not. Does that cause wet dreams?
Yeah, so wet dreams is actually your body's natural way of ejaculating.
Oh, so your dick can talk.
So your dick is dreaming for you.
Tell your brain, brother,
Hey,
long brother, like me
Let it out bro.
Kasih saya one time $50. Kasih kau pangking aja.
Enough. Okay, more. I need to talk more about the
men's health.
men's problem. Okay, what
Okay.
are this one, of course, to protect your clients, your patients, their reasons, right? But what are the common cases?
Common.
Yeah.
Just now I mentioned a lot of them have infection in the foreskin, so they get swollen. So maybe last time they have no problem pulling back, but because it becomes infected and swollen, right, the skin become tight and cannot pull back.
Oh, so this is for circumcision.
Correct,
And what
this
about
for circumcision.
the erectile dysfunction?
Erectile dysfunction, most of the time is either you find it difficult to maintain. So most of the time they have difficulty maintaining erection. Maybe can get erection, but then maybe after a while, come down. Or maybe sometimes they will say that in between when they change position, then the erection comes down.
What's the cause for that? Because you're having sex already, what?
Yeah, so that's a erectile dysfunction. So one of the same causes of all the erectile dysfunction that we mentioned just now.
Because there are some men with their wife cannot,
But
other women can.
That's also another
So does
cause.
it like your testosterone? Does it link? It links with your brain, does it?
Yes. So,
Okay, for example, let me be bloody honest. Okay, let me be bloody honest. I don't know if I'm gonna get into trouble. Back then, when I was in secondary school, okay, then this one is not erectile dysfunction, no.
Okay.
Cannot shoot. My rifle don't want to shoot the bullet.
Oh.
Cannot. Then you know what I do not? I imagine Rihanna.
So
Why doing it?
you're saying you're not stimulated enough to ejaculate.
Is that the right word? I don't know. Like it's hard,
Yeah.
but cannot come out.
Yeah. I guess it's like whiskey dick.
Whiskey dick.
So maybe because you're still young, maybe you're too used to watching porn to ejaculate.
No, I didn't.
Oh, you didn't?
No.
Okay. Or maybe it's just your first few times. Maybe you're not sure.
it wasn't.
That is actually also a problem. Some people cannot stand. Some people can stand but cannot shoot.
Yeah.
The more common problem is the premature ejaculation. Shoot too fast. That's the most common one.
Okay.
Delay ejaculation is not as common.
Okay.
But delay ejaculation, so in the end, how do you solve? I mean, eventually you have no problem with
Rihanna.
No, after that now, no problem.
Rihanna, no lah. No problem.
Now Nicki Minaj.
Because delay ejaculation usually is a psychological cause.
Because based on?
Because you are too anxious. So you're too anxious and that affects your ability to relax enough for the ejaculation.
Is it?
Yes.
Need to focus or not?
Sometimes
Or is it
you focus too much, then you get more tense.
Oh, is it?
Need to relax.
Then if I too relax, I'm not performing.
Not relax the muscle, you relax yourself.
Yeah, relax, bro.
Yeah.
If not, find another girl.
Enjoy the moment.
Enjoy the moment.
Yes.
But
Okay. Okay, now there are a lot of problems. Okay, this is
A lot of problem.
Okay, there are some men who I know who can do it for rounds and rounds, bro. Like, okay, let's say for example, one night stand. They can go like 5-8 rounds, bro, one night, bro. How is he so lucky?
Okay. There are cases where men can be hypersexual.
Okay.
That means maybe they are naturally have high sex drive or high testosterone. So maybe that's why they're able to do that. And generally it's the younger men.
Yeah.
Yeah. I actually had a case of this patient who was American and then he have this problem. He's hypersexual. That means to the point that even after sex, right, he still wants to do it. And then when he ejaculates, it's like a lot. So it was very shocking.
Okay.
Because he showed me a demo of it. And
Video?
Then, so it was really a lot. It's like I cannot believe that this man can ejaculate so much.
Where he gets his ball big, no?
Yeah, so some people are just born like that.
Oh, you suddenly feel thirsty or what?
But you should not use that as a gold standard. That's not normal.
Of course lah.
Okay.
So never compare. Especially now, men like to compare with porn stars. They like to call what they watch on porn. They say, how come that man can do this, do that? How come I cannot? But it's not. That one is just for show. It's not a real thing.
Yeah.
I see.
Yeah.
If I'm not wrong, porn stars take breaks, son.
Yeah, they got cuts, they got edits.
Yeah. And
Yeah.
they
They have fluffers
They will do
What's
first.
fluffers?
Yeah, fluffers.
to help them stimulate.
Oh, is it?
Yeah. So some of them, their wife is their fluffers, bro.
Is it?
Yeah. So the wife understand, they go in, they do.
Oh, it's called a fluffer.
Yes.
You want to be my fluffer or not? sorry.
So I mean, I know some porn stars also they take breaks, and some male porn stars they use the lotions and everything, so they don't ejaculate so fast, or they will masturbate before also. Yeah.
Okay, let's
All
link
sorts of
this
tricks.
with marriage.
Yeah. Wait. Then no pre ejaculation.
Premature
Premature ejaculation. How do you solve
Okay. Premature ejaculation is more common.
that? Okay.
Most of the time, if they have it, it's because they've been having this problem since young. So they've had it their whole life, even with their wife or whatever. So it'll never go away. Okay. It's also psychological because most probably when they are younger, they are used to watching porn and masturbating.
Okay.
And then when they are younger, you don't get caught by your mom, right? So you ejaculate quite fast. because just want to get it off.
Oh.
For example, so your body get used to that duration because your objective was just to get off.
Okay.
But when you with your partner, your objective is not just to get off. You also need to spend time with
Satisfy,
correct, and satisfy all that. So it becomes a problem because it doesn't match. Then the wife or the partner don't get satisfied. So to solve that problem, it's actually retraining. You have to retrain yourself to delay the ejaculation.
Okay, simple lah. Opposite of what I did.
Think of your nenek. It's true. You think of things to delay the stimulation. Yes.
Right,
To
see?
reduce the stimulation.
If I want to ejaculate faster, I think of Rihanna.
Ah.
If I want to ejaculate later, I think of the
There is-
some ugly makcik lah.
Sia lah. Serious, this is serious.
I mean one method lah.
Okay,
Other
thank you
methods
very much.
could be stop and squeeze method. That means you stop just before the point of ejaculating. You stop and then you squeeze the head.
I thought squeeze the bottom.
What bottom?
That bottom.
No. If you squeeze the bottom, it will just come out.
You sure? How you do? Sure lah.
So you squeeze the head. You squeeze the head is because this painful stimuli will sort of tells the penis to okay, there's something going on. Don't ejaculate. But all this takes time and training because most of the time maybe they may not squeeze in time. Then will still ejaculate. So it needs time and practice. So you also need your partner's cooperation to understand why you're doing this. What's happening. So it's retraining yourself to last longer. So it takes time lah. But there's also medication that you can take to double the time.
And this is like before you do it, you take or
Yes,
it's like
you take it before.
I don't like that kind.
Why?
I not say I don't like. I'm not taking any of those. So for example, like Viagra and this type of pills, right? Taking it means you're planning it. You get what I mean? But what if
You
it
prefer
happens?
spur of the moment lah.
Yeah.
Oh, you want it to be spontaneous lah.
I mean, if it happens spontaneously and then you don't have the pill,
yeah, but not everybody is as blessed as you. Right?
Yeah.
It's
So
a
some
problem,
people need
what?
help. So they need to take it lah. Yeah.
but what if they take if they take for in case then it never happens, how?
It's okay.
Yeah.
Play yourself lah. Correct. What? It's like pre-workout what?
Okay. You got take you got take Viagra before?
No. Okay.
Okay.
You?
Never.
Then what you ask me?
No lah, because some men will just try and take for fun.
Okay, I got one friend over there. He take the kopi songkok.
Oh.
Have you heard about that?
There's also a kopi lah. I never heard of this.
it's a lot
Kopi
of
jantan I heard.
Kopi jantan is like kopi jantan. Bro, that one he tell me yeah, your whole body hot.
But most probably there's Viagra inside.
Is it?
Yes, there are a few kopi that they found later that has Viagra.
Okay.
Or those related medication. They put inside the kopi.
Is Viagra illegal?
No, it's not illegal, but you need a doctor's prescription.
I see.
Okay.
So some people died because they're not supposed to take Viagra. They mix with heart medication.
Okay, have you had patients who misuse Viagra?
Okay, when they misuse it's because they buy themselves. So a lot of men, they buy online. They may not know it's Viagra. So maybe their friend recommend, hey, this supplement very good. You take, sure will have stronger erection. So some of these so-called supplements contains Viagra, Cialis. But they don't know because they think it's supplement. It's okay. But usually when the supplement works so well, right, that when you take it, you get a strong erection, you must be suspicious because no supplement is that good.
How long does Viagra usually take to kick in? Like
About 1-2 hours.
it's long.
That's long, yeah. Can watch movie first, yeah.
But I know like Viagra doesn't make you last longer. It's just more like it's just
Stronger erections.
stronger erections. Yeah. And sometimes like some people after they ejaculate, it still doesn't go down, right?
It will take a bit longer to come down.
Wait, so you wait 1 to 2 hours and then you have another problem which is premature ejaculation. That's fucked up.
Yeah.
You wait
Go
2
again
hours, then go 2 minutes finish.
Go again. No?
That's why you need the other medicine lah for the premature ejaculation.
Sure. Hey, woman, having a dick is not easy, no.
Yeah.
A lot of maintenance
Performing as men is not easy.
Yeah.
It's really not easy. The psychological things that we have to go through.
Yes.
I mean, girls always say like, man, just put a cock inside what?
Yeah.
Yeah. But it's not. It's not like that.
Performance anxiety is another big thing. So now younger men, they have erectile dysfunction already because of the performance anxiety.
I see.
They get so nervous to be able to perform.
Okay. Now can I link it to marriage now?
Can.
Are your patients a lot of married men or single men?
Mix lah.
Mix.
So single, married.
So what are the common issues they or problems they tell you like, oh, confirm they cannot do with their wife, so they come to you, is it?
So like those married men, for example, okay, majority will be erectile dysfunction issues. Some maybe low sex drive, low
I
energy,
see.
no mood. So it's related all could be together, all together. I had a few cases where, for example, this couple never had sex before, and then they were basically after talking to them, I realized they don't know how to have sex. So they had never really gone through the sex education because never watched porn, never had sex,
Why, they
no sex
Muslims or what?
education. Christians.
Okay.
So they were like, wait till marriage type. And then after finding out more, then they're not sure how to have sex.
Oh no.
Yeah. So there are still cases like that. Then that's why we need good sex education in schools lah. Because
Wait, then what you teach?
huh?
Then
No.
you teach them?
No. So
Okay.
my place is not the right place to teach because you need a bit more time.
Mm.
So I send to a sex counselor. So there are
Okay.
counselors or therapists who specializes in this kind of sexual education.
Okay. They don't know how to have sex is wild, bro. In today's generation, don't know how to have sex.
Yeah, it happens.
Wow, they really devoted to the religion, bro. Especially the guy. Don't watch porn, don't anything. Oh my god. Okay. Okay. And then okay, so I mean, again, right, common issues that men have, right? Is there any things, right, like men do on a daily basis that actually will affect their sexual health that we don't see at all?
The other things I forgot to mention is smoking. Smoking, very big one.
Huh?
Smoking.
Are you okay only?
Maybe now. You don't know about
In the
later.
future,
Because that also affects your blood circulation. So your smoking will and vaping also. Smoking and vaping. So it will affect the blood flow into the penis eventually.
I don't vape.
Yeah. So all this is another big thing lah. Just now I mentioned like exercise, exercise, stress, sleep, obesity. If you're obese, there's also another factor.
What about tight underwear?
Tight underwear doesn't affect erectile dysfunction. Maybe affect fertility.
Okay, I got a question, doctor.
Oh.
Can you explain to me blue balls?
Actually, that was what I wanted to ask. So that's how you said to
Okay.
train yourself for pre-ejaculation is to hold, right? Wouldn't you get blue balls?
Okay. What do you understand by blue balls? Maybe.
Okay,
So I
this is
first
my theory.
I got feel it before though.
Okay, this is
maybe
my
you
theory.
describe first so I know what I'm
Okay.
describing.
Last time mutik Okay. Then the pants tight. Bubble grow what? There's a space, the ball squeeze. Then pain. Correct or not?
I mean, if it's too tight, yeah, but that's not blue. What I thought blue balls is if you don't
Edging.
ejaculate or you don't ejaculate.
You don't. Yeah, basically in today's term it's called edging.
Oh.
Yeah,
So mine is not blue balls lah, it's bruise balls.
yes.
Yes.
No, I mean,
Yes, it's different.
It can fall under aging also because you are like making out with the girl, then you're very horny, but then it doesn't ejaculate. So that's blue balls.
Oh.
Yeah, so it's like teased. You got teased. Yeah.
So what's your question about the blue balls?
So he basically you answered it already lah.
He
Correct.
wants
or not?
to, so he wants to know if it's true lah. Like for example, if you don't ejaculate and then you get, is there a medical term for blue balls?
There is a medical term. I forgot the term already, but there's a medical term for it. But generally, if you really age for a long time, it's really a long time. So you feel engorged. You feel that your balls is a bit engorged. So you feel a bit swollen, that kind of thing. But it rarely happens. Because most people don't really age that long.
Yeah. But you should try edging, bro. Ask your wife do for you.
What's aging?
Basically, when you want to shoot that time, then don't shoot.
I don't have premature ejaculation problem what?
No, but and then you go again. Yeah, so your wife will make you blah 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 want to shoot. She don't let you hold for you. Edging
You don't tell me what to do. I listen to doctor. But do you have any advice for men out there who just now in the beginning you mentioned they feel very embarrassed. They don't like to talk about the problem because I don't know if it's a man ego. It's a pride thing, right?
I think there's
100%,
pride
bro.
is one because we are raised to be not telling telling other people about our problems. We're supposed to keep to ourselves and solve it ourselves. So we are raised to be like that. Men who just be strong and just tahan and just go through it. So we are raised to be like that. So most men do not want to share their problem. You don't tell your friends. You don't talk to especially you don't talk to your wife. So then they just keep to themselves or they Google and then they search themselves. But then they go down this hole where don't know what they're reading or sometimes they buy their own products online. So the best is if you're not sure, just see a doctor and then you find out, okay, do you really have a problem? Or maybe it's not a problem, maybe it's just a psychological cause. Or if there is a problem, then at least we can solve it. Because another group is maybe those men who, for example, maybe they are older. They feel like my erection not strong, my sex drive not good. I think it's normal aging. But they just resign to it and not do anything.
Redha.
Yeah, redha. Yeah, because they dah tua. Tapi actually you can do something about it. So you and your wife or both of you suffer in silence.
Yeah.
For the rest of your life.
How? I mean, wait. Let me.
I mean, okay. I mean, it also depends on the age, right? If
Yeah.
let's
Okay.
say-
Talking about age, I wanna know like at what age do couples stop having sex?
I mean, I've had couples or patients in their 70s still having sex. There's no cutoff.
Yeah. For as long as he can stand, I guess, and she can get wet.
Yeah.
Wait, see a while, bro.
And sometimes maybe different age, you have different levels of sexual satisfaction, different objectives.
Yeah.
Maybe more like intimacy rather than just penetration and all that.
Wow.
Okay.
This is a good conversation. Normally we don't talk about sex every day.
Yeah.
It's
I
very
know there
informative.
are, websites, right, that allow men to see the doctor anonymously. Or and then they will send your erectile dysfunction pills
How you know?
in a plain. Because I buy my hair shampoo there.
How is it?
Yeah, so they do
Video consult.
video consult, and then they will send the medicine in a black package.
Oh, like mana doctor?
What's mana doctor?
You don't know. You can
Video
take MC
consult.
online.
Yeah.
Something like that lah.
Yeah.
But I buy my shampoo for my hair thinning there. So
Okay.
they got like erectile dysfunction and for a lot of things. Yeah, got even for sleep and everything.
I see.
Yeah.
So for men who are listening to this, how do they
Find you.
find you
Yeah.
for their problems lah?
So you can go to my website for the clinic, Tough Clinic. It's called tafclinic.com.sg.
Okay.
Yeah, so that's my clinic website, and then you can contact us or book an appointment on the website.
Okay. Are you the only doctor there?
Yes, I'm the only doctor there.
Okay.
see.
So got no girl doctor lah, guys. Sorry if you get thinking about it. Maybe they think, but I want
Yeah,
girl
maybe,
doctor.
but then usually they're shy to speak to a female doctor.
I would rather speak to a female doctor.
No.
I
Why?
really would
Why
rather
would you
speak-
prefer speaking to a
Softer.
female? Softer?
Huh?
Yeah, as in more emotional.
More
Huh?
emotional. Why you want
Yeah.
an emotional doctor?
So I feel like women are more
You
emotional.
want to go check your dick or you want to go for a date?
Yeah, no, emotional lah. So if let's say I said and then the doctor will like, it's okay, I get it.
Men also can what?
They will say, bro, bro, normal lah, this
You
guy, I help
toxic.
you lah. Bro,
No,
if you the
you do
doctor,
that?
No,
nobody will
I
see
can't
you.
do
Come,
that.
role play.
No,
role
no.
play. Role play lah.
Usually I think men doctor will like, bro, is that normal lah?
No
Like
lah.
But actually, most doctors are like that. So that's why I'm here to help these men
Yeah.
feel comfortable.
Misconception. You
Yeah.
is misconception. Okay, how would you treat? Let's say he's your patient. They cannot stand.
So maybe first I find out how long you have this issue for.
Mm.
Is it a few months, a few years? Then I'll ask things like, is it suddenly or is it gradual?
Mm.
Like just now you mentioned, is it only with your girlfriend or maybe other girls also can, for example? And then do you have any medical condition? Do you smoke? Do you exercise? How's your sleep? How's your stress levels? And then have you done any health screening? Do you have to rule out any other medical condition?
See? Very scientific, medical and professional.
I know.
You always, if you become dick doctor, of course you would do that. Hey bro, no problem lah. Come see check a bit. Come and tickle a bit, stand. You like that.
If I the doctor and then the guy
Yeah.
tell me, but my wife cannot stand then the best medication is to cheat.
You see?
That's not a doctor.
They are home wrecker, bodoh.
The best is to cheat, brother. Just cheat.
Yeah, you know.
Okay, guys. We come to the end.
Yes. Thank you so much, doctor. Where do they follow you again on IG or Instagram? Or TikTok?
Okay, so on TikTok, my handle is DICKDOCSG, DICKDOCSG. And then I also have a Tough Clinic TikTok, which is TAFCLNIC. Also on Instagram, Tough Clinic. And you can also look for Dr Taufiq Rashid on Instagram as well.
I see.
Yeah,
Wow.
guys, don't be shy. You can just drop me a DM.
Yes.
I mean, everything is what's this?
Confidential.
Confidential. Yeah.
Yeah.
My here I'm like professional. No, confidential. So I don't.
Yeah, but thank you so much for coming. We really learned a lot about our own dicks.
Yeah.
About dicks like in general.
We also learned that last time Sham think of Rihanna.
Now
And
not
fuck
anymore
his
lah.
ex,
Not
yeah.
anymore last time.
Now Nicki Minaj.
No, I cannot listen to the song anymore. I cannot sing over it.
Alright, thank you guys. We'll see you on the next week, next episode. Peace.
Bye.
Bye. Thanks.